Well, good morning and good afternoon, everyone. So thanks for joining us today for this panel titled The Future of Social Research in Southeast Asia, Understanding the Impact of COVID-19 on Regional Research Systems to Boost Better Integration. My name is Francesco Obino, and I'm Head of Programs at the Global Development Network. I also lead a global initiative at GDN that is very close to my heart, called Doing Research, which brings together Southern scholars from across 40 countries to study social science research systems at the country level across the Global South. This panel is an important spin-off of that initiative, and I look very much forward to chairing the discussion today. What we plan to discuss is what is happening to Southeast Asian countries, and by that I mean both societies and the state, and the relationship between these two, in the wake of the COVID-19 pandemic, but also through COVID-19 responses. This pandemic has certainly served as a harsh reminder of the difference between medicine, public health, and a systemic crisis. We went very quickly from a few sick individuals early last year, to entire large groups being sick, to issues such as lockdowns, collapsing health systems, emergency rules, travel bans, huge inequities in the ways measures affected groups and deepen the crisis, but also vaccine mandates being pitted against right to work in some countries, clogged ports, entire global supply chains being stuck, and things like downgrading of technology in key industries to cope with this whole situation. So clearly COVID-19 and COVID-19 responses are much more than a medical issue, and much more than an individual and of course even a country problem. There is a 1849 quote that has been going around that I like, by a physician who was looking at how to solve a massive typhoid outbreak, what was then Prussia, today's Poland. His name was Rudolf Virchow, and he famously said, medicine is a social science, as a science of human beings, and it has the obligation to point out problems and to attempt the theoretical solution. The politician, the practical anthropologist, instead, must find the means for the actual solution. And I think it's interesting that this, 150 years later, we're thinking about the same issues, almost in the same terms. This brings me to the topic of today's panel, which is, what is the role of social sciences in COVID-19 responses in Southeast Asia? What kind of cooperation between social scientists at the regional level can boost resilience in the region, particularly given different capacities across countries? And what's the place of social research system strengthening in ongoing regional integration efforts? First, three speakers who are in this panel are part of a project co-led by GDN and the Asia Research Center at Universitas Indonesia. In April 2021, we invited senior social scientists from 11 countries in the region, or more accurately, 10 countries in the region plus Bangladesh, to describe the role social science knowledge and social scientists have been playing in COVID-19 response in their respective countries. And today we'll hear about Indonesia, Vietnam, and Thailand. The point of the panel, however, is to go beyond that and discuss the future of collaboration and research system strengthening in regional integration. And of course, for that, we have two extraordinary discussants who will join us today. But first things first, I'd like to invite Edgard, Senior Professor at the International Development Research Center, IDRC, to say a few words. Edgard, the floor. And he disappeared. Edgard, I just saw him disappear, but okay. We'll
message in the chat that says, please continue, since my Wi-Fi is unstable, even in Canada.
Excellent. So we'll just keep. But I should mention that IDRC has been funding this program, and IDRC has been a strategic partner beyond the funding for our work on research systems, specifically in Myanmar. Now, we will going unless you want to jump in now.
Well, it's just like to thank everyone and welcome to the panel. You already know my name, Edgard Rodriguez, and I'm representing the International Development Research Center from our Asia regional office here in India. And Francesco has already referred to the joint initiative IDRC has with Global Affairs Canada that started in 2017 to work on Knowledge for Democracy in Myanmar that sought to promote policy research in the country. And for us, the first big question was how the landscape of research looked like in Myanmar. And social research, in the case of a country whose political leadership has shown time and again how hostile they could be to policy advice, is a very tall order. Authoritarian regimes tend to dismiss the role of evidence research and open discussion, especially when that research runs against their own views. So at the time, the GDN had just completed a round of assessments, and we thought it was appropriate to extend it to Myanmar. And Francesco has referred to that work, and it's really history right now, but it drew a lot of attention. The report drew hundreds of people in live and online presentations in Myanmar. We had bilingual reports and even a podcast I will be sharing. The report's recommendations by now are moot. They were to be found in the new strategy for education. All this attention has now vanished due to the military coup. But the eagerness for better research systems is out now. It can only be put on hold. And that's what I wanted to say, Francesco. I think that now Southeast Asia societies are changing dramatically, gaining greater sophistication, confidence, and demanding greater capacity and agency and voice to generate evidence and to use it to pursue different policy paths. And so far, donors have been designing, funding, and at times undertaking directly these research efforts and policy options. And they did it because they were filling a vacuum to get things done, to get things moving. They were good intentions, but they also distorted research environments, as we have found in the case of Myanmar. But Southeast Asian countries, they want to grow their own domestic knowledge. They want to respond to their own challenges with support, but not interference. So I think now the pandemic, it's given them such an opportunity, and this is why this panel is so important. And what has started as a focus on Myanmar is now expanding, in our case, to other cases in Southeast Asia. And this comes to prove that knowledge ecosystems are such an evolving and alive process. They thrive thanks to the collaboration, exchanges, and connections among the partners like yourselves in this conference and in the panel. So I'm particularly looking forward to hearing from our colleagues at the Asian Development Bank, from a former IDRC regional director and colleague, Sciortino, now at Mahidol University, and from our Vietnamese partners, the POSENT, and especially the Vietnamese Academy of Social Science that has been a long-term IDRC collaborator. So without further ado, back to you, Francesco. I'll stay in the back. Thank you.
Thanks. And thanks for all the support, of course. I suggest we start, and I wanted to start with Inaya. So, I mean, just an overview of the session. We have about 15 minutes of presentations covering a few key points from the three countries that we have represented here from the project. Then we'll have about 15 minutes of comments from discussants, and then we'll have hopefully 15 minutes of discussion after that. And we can go back, of course, to specific speakers, and we'll get questions from the audience. Please use the chat to comment and ask questions. I'll pick a question from the chat as we go. I just wanted to invite you to tell us a little bit about recent work on the experience of social scientists in Indonesia. We've been on the sidelines of COVID-19 response. Dr. Inaya Rakhmani is the inaugural director of the Asia Research Center at University of Indonesia. She's been an amazing partner for GDN and doing research programs since its inception in 2014. And we even recently joined hands to expand this work jointly in Asia, our work on research systems. She's also, I should mention, the Deputy Director for Science and Education at the Indonesian Nguyen Academy of Science. Inaya, do you want to tell us what, you work on, of course, on the note of Indonesia, part of this project, but also on the regional synthesis. What did you learn so far about the role of social sciences in COVID-19 response?
Thank you, Francesco, and hi everyone. Really happy to be here. I just had a discussion last week with Rosalia about this regional comparative note, and while the discussions for synthesizing the findings are still on the early stages, but the 11-country study that we have accessed finds that different types of inequalities have been exacerbated with the pandemic in Southeast Asia, and governments across Southeast Asian countries, while with varying degrees, are grappling and containing the multidimensional health crisis, in which social sciences could provide a more prominent and stronger role in informing the kinds of responses that the governments have to those most marginalized in the impacts of the pandemic. So in short, the pandemic exacerbates, worsens pre-existing social inequalities. The majority of countries in Southeast Asia experiencing a surge in cases up to this point, where some countries are actually experiencing a decline. And it's safe to say that most of the countries in Southeast Asia, government put funding into healthcare services, equipment, testing, vaccination, while at the same time, the spread is very much social because its spread is being contained and being accelerated with physical and social mobility. So it is, in a way, a social issue that takes the form of a health crisis. But unequal prioritization of research funding is given in the policy from the policy responses to health approaches rather than social approaches, in which there is an increasing need to decrease or contain the mobility in some areas, villages, districts, cities, provinces, in comparison to other areas. It's a pressing time for social scientists, not only in the Southeast region, but also beyond that, to interpret and analyze why and how some policy responses are effective and why some are not, why some methodologies are privileged and why some other methodologies are not. And across these country studies in the 11 countries in Southeast Asia plus Bangladesh, we see that there is a marginalization of immersive, ethnographic, qualitative research methods that actually are ingrained in the kind of communities that experiences the worst marginalizations in the health and social responses during the pandemic. And these approaches are actually very important in comparison or in combination to generalizations or survey modeling or statistics to also give deep accounts of vulnerable social groups who are often socially positioned as vital workers. So they're domestic workers, seafarers, construction workers, drivers, and delivery persons who still have to be mobile during the pandemic. And in this case, understanding the standpoint of those most vulnerable during the pandemic is something that social scientists, ethnographers, anthropologists can contribute to, because we need to understand the social world from their standpoint so that policymaking is informed not only by statistics, but also by qualitative and in-depth approaches. At the same time, those in the marginal positions can also inform us about effective, alternative, and also innovative approaches that come from the margins. And these are the kind of communities across different countries that find their ways to be resilient without actually romanticizing their approaches, because at the same time, for them to be effective and so resilient, it means that the state was not present to provide them with basic healthcare services and social services. While the ways that these alternative developmentalist resilience emerges from the margins, at the same time, we need to give proper appreciation and acknowledgement so that policymaking can also be informed by the more community-driven approaches that exist in spite of political and economic barriers across the region. So that's a bit of the insights that we have got so far. Francesco, over back to you.
Thanks a lot. I really appreciate the double emphasis on the medical response to a social issue, but also the kind of bias internal to social sciences against the four specific methods that have been emphasizing really the attention on surveys and against that kind of that practical anthropology that that quote from 1849 was already referring to. Interestingly enough. I'd like now to turn to Rosalia. Sciortino Sumariono is a professor at the Institute of Population and Social Research, Mahidol University, a visiting professor at the Master in International Development Studies Longkorn University in Thailand. She's also the director and founder of Sea Junction, which is a public venue for interaction and cross-learning in Southeast Asia as a region in Bangkok. She's an emeritus Asia Regional Director for IDRC and former Director of the Foundation, as well as former Senior Advisor to USAID, and the Ford Foundation. You looked at, of course, Vinicius who's also in the audience today. You looked at the experience of Thailand in COVID-19 response and the roles that social science knowledge and social scientists played in it. What are your key insights? Also, bearing in mind kind of the exposure you have, of course, to other countries in the region, or in fact to previous crises that Thailand had to tackle.
I was just talking about thanks. Thanks to Francesco, and thanks also to my former colleague for involving me in this study. Thank you to Inaya, who has been indeed an exceptional team leader to keep us all together and on time. It was a very quick assessment, about 3 months. Of course, these are just preliminary insights that deserve to be, for sure, to deserve more in-depth examination. But there are indeed some common trends. I will talk here mainly about the situation in Thailand, and also maybe compare with the HIV/AIDS epidemic for the different way in which social science were involved in both epidemic. Now, if we look now at the formal handling of the epidemics, we have to say that in Thailand, because of the political context, as well as the appreciation or low appreciation of social science in government institution, the role of social scientists in the formal bureaucracy that has handled the pandemic has been minimal or marginal. It has been, the pandemic has been seen as a security issue, as health issue. We have had an old discussion about securitization of the pandemic, and there has been much less attention for the social aspect of the pandemic, which, like Inaya has very well said, are crucial because we should not forget that we are talking about people behavior. The whole issue of using mask, not using mask, staying at home, not staying at home is an issue of behavior, as well as the conditions. We are now more and more aware of the living condition and work condition are crucial into the spreading of the pandemic. Yet in Thailand, and I think also in many other neighboring countries, social scientists, even medical anthropologists or they have not been called to reflect on this issue, to, for instance, understand clusters. They could have very important insight. In Thailand, the pandemic has spread, the various waves have been associated, for instance, with entertainment place once with migration place where migrants live because of the poor living conditions. So there is a lot to understand about, for instance, this cluster, and social scientists could have played a role in the formal response to the pandemic. So that has not happened, or maybe not sufficiently formally, but fortunately, social scientists have been active outside of this formal canon in a number of roles. They have still done research on a number of topics that are such, for instance, impact on the gig economy, also of people working in the gig economy, impacts on people working in the tourist industry, which for Thailand, of course, is crucial to the whole. Thailand is the worst country in terms of economic situation among the Southeast Asian country, also because of the dependency from the tourist sector. Issue of migration of migrants, the way they live, etc. They have continued to conduct research outside and try other way to communicate with policymakers, or informally, because as we know, a lot of communication happen informally, but also through the media. And that has been a very important channel to provide alternative views to the population that otherwise probably would not have been heard. They also have played a very important role in collaborating with NGOs, like Inaya has said. Community have had their own response. We know that social protection policy have been insufficient. They have not covered enough the most in needs, for sure. They have not covered the informal sector as it should have been. So there has been a lot of individual and community initiatives, and social scientists have often collaborated with NGOs as well as community group to provide the new evidence, for instance, on where to provide relief, how to identify poor household. A lot of work of social scientists has been done in Thailand in that area. I could go on, but I think the key conclusion at the moment, and as I say, it's a preliminary, that even if the official role, meaning of involvement in bureaucratic structure, has been limited because of a number of factors, there has been really a very important role outside of those bureaucratic structure, both in terms of strengthening community and NGOs activity, as well as providing alternative views in the public media and venues. Thank you.
Thank you, Leah. Very interesting how you seem to describe a situation where social scientists played a role as public intellectual, despite, in fact, the way the COVID response was.
Yeah, sorry, I forgot very quick. What is the difference with the previous pandemic? I think with HIV/AIDS pandemic, clearly social scientists were much more involved informal. It was recognized as a behavioral pandemic, and they participated very strongly in all kinds of activities in Thailand, and I think contributed very much to the success in the prevention of HIV/AIDS, which Thailand was one of the countries most affected. So I think there is quite a big difference, which we should reflect why that time was the case, and this time has not been the case. Thank you. Sorry, I was almost forgetting about this.
I thought you could comment on that, because that's extremely interesting. You know, acknowledging that there was a very positive experience in the recent past, not so far ago, that seems to have been. I'd like to turn to our third kind of right now, Dr. Nguyen. Apologies for mispronouncing the name. Who's the university, and is the co-founder and chief economist of the Development and Policies Research Center in Vietnam. He's worked for the Ministry of Industrial Trade and the National Council for Science and Technology Policy before founding the Development and Policies Research Center. He's also served as an economic advisor to the Economic Committee of the National Assembly of Vietnam from 2008 and 2012. Dr. An, I wonder whether you could share with us insights from your own work on Vietnam, and perhaps also tell us a little bit about what the experience of Vietnam, how the experience of Vietnam could benefit smaller countries in the region. And please, can you please unmute? You're still muted.
Okay. Thank you, Francesco. Good afternoon, everybody. You know, I like to say thank you for Annika and Rosalia, because you have done a kind of very good job, synthesizing the experience and study of all other countries, and the experience in Thailand somewhat resemble what we are experiencing here in Vietnam. So it's been kind of privilege to be part of these projects, and I must say that I'd like to respond to your last point first, because you're comparing the current pandemic with the last one, the HIV/AIDS. Because HIV/AIDS was happening at a slower pace, right? Whereas the COVID-19 is happening at a faster pace. It's been spreading out across the globe. So that's though to some certain extent, explain why a lot of government, especially our government, has been, keeping up guard when we are facing with the COVID-19. So coming back to the situation in Vietnam, in the first 3 phases, we were doing really well, keeping the COVID cases low. But in the current one, we are, having a serious problem with the number of, infection cases were increasing. Even at the during the last 2 weeks, it has been, reducing. But there's been a lot of debate whether the situation is because of the economic pressure. So the government has been, under pressure to open the economy, or in other words, lessens the restrictions on the lockdown or prevention measures. Coming back to social science, officially in the first 3 phases, we see very limited roles of social science researchers in the formulations of policy in comparison to the health policy or hard science or engineering policy. For example, in the case of Vietnam, the government has been very much active in asking the social in asking scientists, especially engineers, to come up with a technological solution like producing masks, technology, ventilator, or they are mobilizing the health, public health researchers in formulating the policy to cope with the COVID-19. Whereas the social researchers are playing a very minor role in the first 3 phases. Only recently in the last 2 or 3 months, then we have seen some progress towards incorporating the social scientists into the formally, and I take your point here that our colleague Rosalia mentioned before, that maybe some informal way that the social scientist has been, communicating their research result or advice to the government. But obviously, for the first time, I think in Ho Chi Minh cities, the government has been nominating a team of social researchers to deal with the COVID situation in the cities. But that is special case in Ho Chi Minh City, but not the for the wider whole countries. The social researcher in that operating in that situation, a lot of them has been trying to communicate their advice through the media, through Facebook, through the newspapers, or writing op-ed to communicate a certain research result to the government. However, something called like research-based policies formulation, we don't see many research-based policy formulation yet in the countries. Luckily, in the case of Vietnam, there's a number of donors has been quite active, like the World Bank and the UNDP, and they provided a number of resources so that the social researcher can can be tagged along, so that their view can be made through certain forums. And I think that the situation in Vietnam. So I think in the last 2 days, in kind of summing up, there was a high-level meeting between the Deputy Prime Minister with researchers, but most of them are natural scientists, engineer, and even health researcher. but not, social scientists is not even mentioned in the discussion as yet. So that's how I learned this in the country. And of course, the COVID is kind of still unfolding. We will never know. It's still a very uncertain environment. So there's a room there, of course, for us, to make our voice to be heard and to the policy making for the better, for the betterment of the societies. So, but that will take a lot of work.
Thank you very much. Yeah, the free commentaries that you just shared, Rosalia and Anne, is that in a scenario where there's a huge need, where capacities exist, including some experience of better integration of social science into policy debates, but there seems to be a missing link. Yeah, so I think this is useful to realize that the issue doesn't seem to be the lack of capacity, so the lack of social science, the lack of research capacity in social sciences, including to work on urgent policy issues. It's just a missing demand from government agencies to mobilize these capacities. Now, I'd like to turn to Professor who's as a professor and a vice president of the Vietnam Academy of Sciences. He also is the vice president of the Asian Association of Social Science Research Council and the secretary general of the Vietnam Sociology Association. So it would be very interesting to know from your perspective how things look like. Given this huge need, given social scientists seem clearly to be very eager to research and to contribute to the debate, not necessarily advocating for putting them in charge of decisions, but since there is a demand and capacity, in fact, perhaps you work in from the perspective of science councils, for example.
Okay. So first of all, I would like to thank Francesco and GDN and IDRC for inviting me to this meeting. I very much appreciated the section's themes today when we talk about social research intelligence. I believe that regional corporations to the research capacity by each country to get our research in social science and identify the topic across the regions in the next few years. The topic of interest after the COVID pandemic appears, and especially since the onset of the COVID pandemic, it affects individual scholars and researchers in many countries. And I have to say that some in Japan already passed away due to the pandemic. So our network, our staff, our people is not in the place as before the COVID. In general level as well as in the regional level, I can say that the situations, inequality and discriminations are occurring in the global level and accelerating its negative impacts on our economy, our health and government system. I agree with you, your points saying we need to look at the social aspects of the crisis, and it is actually neglected over the last to some extent. So in the midst of this crisis, it's important for social scientists in the region to share our problems and dialogues to address. About the topic, I have to say that from the COVID pandemic, researchers, professionals have been at the forefront of the national and regional COVID response. For example, in the Academy of Social Science I am working, we found a new model to deliver the economic stimulus to prediction of the infection, and also looking for the mechanisms to ensure the social protections for people affected by the pandemics. Last week, we launched a short report on vaccinations, how people can vaccinations in Vietnam. And I sent it to the Deputy Prime Minister, and he called me saying that. So I think that we'll talk more about the policy and research and evidence of research in social science for today. But one of the topics of research that social scientists in Southeast Asian country may need is a recovery and adaptations of society and people COVID-19 in the new normal situations. Good news from this month, the government of Vietnam the approach from zero COVID to flexible and effective adaptation. To restore the economy, transport, cultural and social life. And also, obviously, we believe that vaccination remains a key weapon. It's a weapon, the key means against COVID. All people, wherever they are rich or poor, should have equal access to vaccine, which offer the deadly virus. So we need to look at in employment, in education, in family, children, labor migrants, elderly aspect of issues, as you mentioned in the paper. However, I have that there are many vulnerable people in the regions, including in Indonesia, Thailand, Vietnam, who have not yet restored or recovered from the crisis, from the impact of the COVID. And they are also not fully vaccinated. We need to look at it as a very practical and realistic problem today. So social scientists in the region will need to conduct kind of research or study on the unequal to vaccine, as well as how COVID can exaggerate the gap between the rich and the poor, the social and human development. Second issues I would like to mention is regional corporations and integrations of social science. I think to provide opportunity for social scientists to engage with and other stakeholders in the regions to share the valuable insights and capabilities of our in dealing with the complex social and environmental change and challenge today. I wish to mention we have been very hard to maintain our regional networks during the COVID. I am working with the Secretariat of ASHAREC. For those of you who may not know what is ASHAREC, ASHAREC is the Association of ASEAN Social Research Councils based in India. We plan a conference this month on the 26th to 28th October, just 7 days from now. For those who want to attend the conference, which has getting the futures with COVID-19, the role of social sciences in Asia. So it's very relevant in our discussions. So on 26 October, by the Academy of the Social Science in Australia, play a role of secretariat since 2006. And there is no limit on the number of delegates to attend this. Faculty, researchers, policymakers, stakeholders, members of organizations are invited. I encourage you to attend ASHRAEC conference, and I am sure that he knows about this because he wants to present a paper on this conference. Vietnam is getting better after the wave of COVID. I have to say that. But I do understand and share with you that the social impacts in terms of restoration, recovery, and adaptations to the new situation is still issues to study, and I hope that my view can be accepted with our sections. I think time is up, so let me stop here. Thank you for your listening.
Thank you, and of course, thanks for the plug for once again. And we'll have a presentation on this very project there as well, and it's terrific. It's really a terrific program there. So we'll post the link in the chat. I very much like what you say about the cooperation, because you say we should reevaluate our research capacities. This is exactly what we're trying to do at GDN with doing research assessments of the national social science research system as a starting point for discussions about how to strengthen capacity, how to cooperate more and with international donors as well, and of mainstreaming COVID response and learning how to live with COVID. Of course, implies that we think about the whole system. So education, of course, health, the economy, and this is not just an issue about COVID response. If we decide to adapt to COVID, it's about how to rethink everything so that will not translate into such harsh impacts on us. Now, I'd like to turn to Mrs. Aiako Inagaki, who's discuss today. I'd like to, of course, enough time a little bit. So, Mrs. Inagaki is the director of the Southeast Asia Department and the Human and Social Development Division within that at the Asia Development Bank. So she leads the planning, implementation, and supervision of ADB's lending and non-lending operations in the social sectors. That includes education and skills development, health and social protection. And she's also the chair of ADB's health sector group, where she guides the preparation and implementation of the health sector group. Well, I suppose this has been a very busy year and a half for you. So I give you the floor. I'll be really interested to know where all of this discussion about research capacities and strong research systems as an essential ingredient to resilience of societies and states, where does it sit in the larger efforts for regional integration in the region from your perspective? Thank you very much. The floor is yours.
Yeah, thank you. Thank you very much, Francesco. And it's such a pleasure to be here today. I'm really appreciative of the very candid, frank, discussions around challenges that social scientists face in actually perhaps what I understand is better making a linkage between social research and how it reflects in the policy making, particularly when we're talking about how to reach out to the most vulnerable population that were affected by the pandemic. Maybe share with you some perspective seen from a development bank as we have joined some of the discussions that involve both health-related research and social research and policymakers together, and those I think insight, if we could help in strengthening the science and policy interface in the regional integration effort that we're talking about here. To me, there are three important lessons that have emerged through this COVID-19 pandemic related to the role of science and policy interface in regional integration. The first is the importance of a multidisciplinary approach. The second is the role of big data in evidence-based policy making. And the third, and to me it's probably one of the most important one, is the importance of community engagement and having a strong communications program in effectively conveying the science and policy message to the broad public, and particularly at the community level. So let me just enumerate a little bit on these 3 points briefly. The first, the COVID-19 pandemic has really illustrated the importance of this multidisciplinary science policy interface to ensure that all aspects of the pandemic are addressed. So in the early stage, we saw the creation in several countries in Southeast Asia of a multidisciplinary task force that sat together to discuss the emergency response to the pandemic. So this task force brought together, health experts, military strategists in some countries, economists, social welfare-minded policymakers, knowledge managers, communication experts, and political strategists. They work quickly to put together a science-based but socioeconomic responsive plan to battle the disease on many fronts. I know that there are some challenges and has been really illustrated by the speakers here today, but at least looking at from the development bank side, I think this multidisciplinary approach on the science policy interface has been critical. So after 18 months, what we have seen is that countries that were able to balance that multiple challenge brought about this COVID-19 are the ones who have emerged from the crisis or have been managing the crisis slightly quicker than others. Now, the second is that this pandemic has revealed the difficulty of crafting the timely emergency measures using the traditional data based on recurring government surveys of household and businesses. I'm sure you know, some of you may know much better than I do. But first, such data are typically available only at a low frequency with a significant time lag. And this is a killer. For instance, disaggregated quarterly data on consumer expenditure are typically available with 1 year lag, even, for instance, with the US Consumer Expenditure Survey. Now, second, such statistics also typically cannot be used to assess granular variation across geographies or subgroups. And due to limitation in sample sizes, most statistics are typically recorded only at the national or state level, and breakdowns by subgroup of sectors are often unavailable. And I think there was a discussion here also, that in order to reach out, in order to get timely information on the real effect of the COVID-19 in the most vulnerable population. So these statistics needs to be there. So during the pandemic, we saw that many governments relied on technologies such as satellite data, telco data, and other big data from digital marketplace to shape their COVID-19 response and recovery. And this is because the data, they track economic activities at a high frequency and a much more granular level. And this data is also relevant because it can capture people's livelihood directly. And this is, again, something really, really critical to know, really how people are being affected, have been trying to cope with the situation on a daily basis. So in combination with the conventional data, the big data from the digital application will be very useful in making better policies to unleash the full potential of digital platform economies. So to me, it's quite essential that some of the national, statistical agencies work together with these platform companies to obtain these information, but expanding on traditional and other alternative data sources. My third point, this is about the public responses. We have seen some difference in the public responses to two key measures to flatten the curve and contain the pandemic. One is, it hasn't been, of course, popular, but countries had to do that, is the impositions of total or granular lockdowns. And the second one is the push for COVID-19 vaccination. So, and in both aspects, the state has had to use some coercive power to implement these policies, right? I think it's very important to reflect on these issues. My take is that community engagement and communication have been too slow, such that the government messages have been drawn by the noise generated by regular as well as typically a very busy, social media. So it's quite important that we work with community structures and conduct a very systematic and organized mode of communication to broadcast a singular policy actions. And, those measures by the government, the public messages are usually usually something that we don't want to hear so much, no? Is a vaccine safe enough? When am I going to get the vaccine? School closure. When my kids can my kids really, cope with online learning? My neighbors are getting some emergency cash assistance. How come I'm not getting it? Those are very, very sensitive issues. So it's really the importance of, how the social research really will feed into better strategic public communication strategies. So I stop here, Francesco.
Thank you. Thank you very much for those very sensible comments. I think there is important questions about how the challenge looks like, for example, a development bank. Because I hear in some, your point, you acknowledge some task forces, then you list some of the profiles that have been. Most people, maybe in this room would think, there's no sociologist, there's no anthropologist, there's no, etc. So there's a genuine question around, how inclusive can a task force be? Yeah, find that inclusivity in task force. We have the right knowledge. On your second point on big data, very interesting because it goes back to a very very important point about the speed of. Right, we cannot how quick must information be and how granular must information be in order to become taking policy decisions. This is a long-standing debate which won't solve. But I think I really hear that also in your comments about the need for partnerships with actors that and have. And again, the third point, it's interesting because the debate on the communicate with how to make it for research which are not the ones we want to hear, is of course something that defines on social research as well. So ultimately, these are aspects research works that bring back to the notion of system, right? So how does the system work across the production and the uptake of demand for social research knowledge? What we're trying to do with actually exactly what we're trying to do with the research program at GDN, with this country studies that really try to map capacities for the production, for the diffusion, and for the uptake of social science research at the country level as a base on how to improve on that. Now we have 4 minutes left. I'd like to ask anyone whether you want to say a few final comments. I think is the most useful step forward, right, in terms of strengthening cooperation in the region. I don't see many questions from the audience to post on the chat. Is there any reaction or follow-up from panelists? So from Inaya, Leah, and Anne, who spoke first, would you like the floor for 1 minute?
Maybe I think indeed the key issue is how to feed for social scientists to feed into policy process, not at the end of the policy process, but at the very early stage of formulation. Now, we have indeed multidisciplinary, interdisciplinary, transdisciplinary. I think we have many decades that we have spent, and I think on the formal level is recognized, right? We all would agree that COVID-19 requires a multidisciplinary. But when we look at the task force, for sure, Thailand, we have looked at the official task force. There is not even one social scientist. There are economists, macroeconomists. So clearly the concern with the macroeconomy has always been there. So economists are social scientists after all, although we don't see it that way as an anthropologist, but they are there. So the macroeconomists are there, but where are all the others really in the formal body? And I don't think this is only Thailand. Thailand may be a particular case, as I say, because of the political context and everything, but I think it's reflected in many other. So the real challenge is how to really show the importance. I mean, it's a question, of course, of showing the importance of social science for health, and not only for social protection and vulnerable group, but even for the health itself. COVID can spread because we don't pay attention to the socioeconomic condition in which people live. I think this is the message that we need to strongly give. So even for prevention purposes, even for containment purpose, you don't need only mask. You also need to change, for instance, the air conditioning and the way people sit inside space, etc., etc. All kinds in which social scientists should contribute, beyond, of course, the issue of vulnerability, social protection, and many other aspects. And I think we need to start to scream louder, probably, and make a more clear point about the possible contribution of social science. We have done this for many years, again, but then we need to find, so I really appreciate the issue of interface between policymakers, and probably this is the key. It's not a question of capacity, it's not a question. I think the capacity is there, the will is there, but how to ensure that there are formal mechanisms for social scientists to contribute to policy process.
Thank you, Leah, for that. It's telling that somehow we came back to that quote from 1849. I mentioned at the beginning, right? It's just making the case for it's not a medical question. It's power balances and inequalities that allow this to spread and go around. And unless we look into those aspects, into how our societies work, of course, we won't be able to. I'm afraid we actually ran out. We easily use another hour to discuss from here, but I think we'll have to close it now. I'd like to thank very much all the speakers and IDRC, of course, I want to Discussants. This was meant to be kind of a conclusive discussion. This is the one in many discussions we want to have going forward. And as a kind of plug, I'd like to everyone to join the AASS Astra next week. The program is really terrific. Yeah, I think the program itself shows what about something like the current of the panels and papers are really. We'll also be launching country webinars, original webinar, Millennium Country Project that next month. So Thailand on the 13th, Indonesia webinar in Indonesia on the 29th, original one on the 24th. The best way to keep up, up to date with the discussions is on social media. Subscribe to the GDN website, gdn.im. Search, and we'll keep dates and opportunities to keep this discussion going. Once again, thank you again and to all our audience. It was a pleasure and hope we can continue soon.
Thank you very much.
Bye-bye. Thank you.
Bye.
Bye. Best of luck.
Bye.
Em tắt đi. Thử xem là cái thằng khác còn ở đây không.